Everybody likes the new logo. Everyone like that? All good?
I like the new logo.
All good. I hope you guys like the new logo as well. Ladies and gentlemen, welcome to the highly trained and wildly unfiltered, what is it? Just our podcast.
Yeah, it's our healthcare podcast.
Healthcare podcast.
You got to bring that up over there.
Healthcare
podcast. It's the no BS breakdown of the body, and I am your host, Dr. Pete, chiropractic physician. I am with my co-host over here. She still doesn't like the title. However, she is Keri Moran, physical therapist and clinical genius.
It's that I don't like.
Can I go with clinical physical therapist extraordinaire?
Yes, but what about the clinical genius?
After
I
all
kind of
this
like
years.
it.
I mean, I love clinical PT. I love
You're freaking amazingly good at it.
Genius
Why are
just
you not a
sounds that
genius?
sounds like a lot to hold yourself.
I'm
to.
saying it about you. It's not
We
like
have
you're
to
saying
sit
it
at the
about
Genius
yourself.
Bar. You can.
Yeah, I don't get a seat at the
It is
Genius
to-
Bar.
Yeah, that's right. All right. So, dum Keri Moran. Here we go. And with our second appearance, it's never happened before because this is only our second episode. Dr. Kim Delmage here, joining us again on the highly trained, wildly unfiltered podcast.
Yes,
Healthcare
absolutely.
podcast. Healthcare
Healthcare podcast.
Yes.
He's never going to remember that part.
No, I
don't
will.
think so.
I know. This is
Nope,
number
it's not.
2. It's number 2.
All right, fine.
Well, I don't know. You did amazing on the first podcast, and so did
thank
you,
you.
even though you haven't seen it yet.
Yeah, I haven't seen it.
No,
He's telling
I
me I
haven't.
did
I
well,
sent
but
it
I
to you.
think
It
he's
didn't
just-
work.
Both of them didn't work?
It did not. It did
Technological
It did not allow me access.
Technology genius, Dr. Pete over here, as you can tell. So I'm the same genius as she is over there in clinical.
Yes, exactly. Exactly.
All right. Well, neither of them have even seen the first episode that I have, but you guys have seen it. No, you haven't. Nobody's seen it yet.
Nobody's seen it. It's live.
Honestly, like Kim, you did such a good job. I
was
loved,
amazing.
all of our talk about prenatal, postnatal, and for any of our viewers that don't understand what that is, prenatal is while you're pregnant, postnatal is after.
Yes.
A barrage of issues that Kim deals with, and then
Absolutely.
her work with newborn babies.
Yes.
One of the things we wanted to kind of dive into today was what happens after that. How do you integrate your care as a chiropractor with toddlers, babies, adolescents?
What happens?
By
when
the
they
way,
go
I
out of
don't-
that little newborn scrunch phase.
So what is the levels? Is it toddler,
So
adolescent?
first,
what-
like newborn.
So newborn, you're going to
Infant.
go up to the first 3 months.
Okay.
After that, we
Infant.
consider them infant.
Okay.
Once you're a year old, you move into, I call them the waddlers because not all of them are walking yet.
Right.
But then toddlers, you go up until the age of 3.
adolescent?
And then preschool,
No.
then preschoolers, school
Yeah.
age, and then teenagers, yeah.
All right. Well, there you go.
Yeah.
All right. So we are up to, obviously, beyond the newborn phase.
are beyond the newborn
we're at
phase.
3 months, so we are
We are at the 3 month.
waddler.
Yeah, the little tiny infants, the ones who have started to move around, started to get more interactive. They are starting to meet some of those milestones that we talk about and that you read about online. And a lot of the things, I have parents come in and they're all worried. Biggest issue that I hear every day, and apparently our lights are turning off. We didn't
they
move, we
shouldn't
didn't
have
move
been
around
on in the
enough.
first place. Yeah.
Okay.
It's all good.
We didn't move enough.
We actually look better now. We the
Dimming.
studio lights are on and the
Okay.
overall lights are off.
So a lot of moms have been stressed out. And I said, years ago, I'm dating myself because my kids are teenagers. But back in the day, they had this thing where they had all moms freaked out about breastfeeding, where breast is best, formula is terrible, and don't give your baby a pacifier. Well, now they've shifted it, and everyone is completely freaked out about their baby having a flat head. Flat head, to do the tummy time, and parents are, does my baby have a flat head? I think it's a flat head. Like, well, your baby can't even hold their head up yet. So
And it's almost become like you're a bad parent if your kid has to end up in a helmet
Oh my
because
gosh.
you did a really shitty job as a parent.
there's a lot of
It's like-
there's a lot of
it's a lot of
judgy.
judgment
it's
around.
a lot of judgy. Okay, and I have seen this so many times. We even had one of our own staff members
Yeah.
whose child had to go in a helmet for a short period of time.
Yeah.
And he, as a physical therapist, was
was-
even more mortified because
Right.
like
He
he
was
felt like he
crushed.
should have known
Yes.
more.
Absolutely.
But I'm like,
Absolutely.
it happens. You
It
know what I mean?
happens.
It's like,
Absolutely.
But here's my
and he's
question.
a twin. They are twins.
How long have women been having babies for?
Pretty long time.
Yeah, a really long time. Why do we need helmets now?
Because insurance will pay for them.
God.
Sorry, not supposed to talk about that.
Shmish more
that-
shit.
that's
That's
unfiltered.
unfiltered. Millions and millions of years,
Yeah.
babies have been popping out, and they have been laying on their backs until they got up and they rolled onto their
Yeah.
stomachs,
Yep.
and everybody has survived.
Yes.
Am I saying something I shouldn't say?
No, but the
No,
irony of
it
it is that
is.
you will have
It
some
is.
doctors who push the helmet
Yes.
and other doctors who push chiropractic and physical therapy to
Yes,
reinforce tummy
absolutely.
time and get their speed and progress up to date
Up to
versus
date,
put the helmet
exactly.
on and,
Yeah.
and hope
And
that gets rid of it.
I will say one of the top neurosurgeons that I would literally trust with my own children. I've had a long discussion because his practice sees babies with legitimate reasons where they have birth defects, where they need a helmet because their brain
Right.
is actually not able to develop fully because of fusion. He is very firm in the belief that I am, where the problem is not coming from the outside in because the baby's head is here. The problem is coming from the muscles in their neck and the baby not being able to turn their head properly so that the pull is actually happening from the front and it's diagonally affecting
Right, so almost like the way we
backside.
say like a chin tuck
Exactly.
for adults. It's like putting you in
Exactly.
that.
Tech neck, right? What everybody
Yeah.
realizes, right? As your head comes forward, you have to lift your head up to keep your level horizon. What is that? The writing reflex, right? And so all those tight. That's why these muscles are tight. You're not this way. You're this way. It's the same thing.
Yep. So
It's SEMs and the
once
scalenes.
we've left that newborn phase, when a baby is starting to be able to hold their head up and kind of move around more, we see babies who tend to favor one side more than the other.
Right.
Every time you put them down in their car seat, you see their head is this way, or their head is tilted over to the side, or when you try to breastfeed, they fuss more on one side, or when you feed them a bottle, they're always turned to look at you.
Right.
And this can be as simply as a person's right-handed and they're holding the baby this way so they can hold the bottle in the right hand.
Right.
So that's a more comfortable position for them. Their baby's turned this way. If I keep my head turned this way all day, my neck's going to be stiff on one side.
Especially if you're days and months old.
Yes, especially if my head weighs 2/3 of my body weight and I'm trying to hold this giant thing up. The neck muscles are really strained, sometimes from as early as the birth process.
Talked about that on the last episode,
And if
right?
it doesn't, if it doesn't get addressed in the beginning, the older the baby gets, the more we're going to start to see that
Right.
because they're doing more things now. And a lot of people pick up on that in that kind of 3 to 4 month phase, which is where...
Now, manually as a chiropractor, what are you
Yep.
doing with that baby when they come in? Are you
Absolutely.
massaging them? Is it
so
stretching?
most of it, a lot of massage, where we will go in. We'll also see if there's any restriction in the joints as they're forming. So the muscles around those joints, again, no big cracking sounds. We don't do that to
Right.
babies. It's a lot of just pressure in that releasing muscle restriction so they can turn their head all the way. A lot of times as we're doing it, I love to call it the turtle, where the baby will come in and they're all scrunched up with their shoulders and the parents will say, I can't even wash in there. They
Yeah.
spit up and the milk's all in their neck. And then as we're working on them, we see their little head just stretch up.
Yeah.
And you can see parents say, he has a neck.
All that dry milk that's been in there and puke and
It's
nasty.
It makes bath time much easier
Yeah.
because now they can get in there and they can clean it out.
And the simple indication is when they lay in their car seat and they're stuck to the
And
right
they're
and
always
over
to
here
the
like
side.
this, or they're stuck to the left.
Yep.
It's such a simple indication for a parent to know,
Yeah.
let me go see Dr. Kim or another provider that does this type of stuff.
Yeah.
So
Simple.
I'm sure a lot of the part of it is you're educating the parent too, because once that baby goes home with the
Exactly.
parent, if they're not picking up on these cues and things, then you're
Yeah.
teaching them how to like reposition by putting like maybe a toy in the car is over on this side of the right side versus
I will
the
tell
left.
parents that one of the best things you can do, be boring on the side you don't want them to look at. Be more
Right.
exciting on the other side.
Yeah.
If they have an older sibling, I said the best therapy tool you can have when you have that baby on the floor, have that older sibling, have that puppy, have that mirror, have whatever it is that they're
just
really into. On the
I'm just
side you're
thinking of the
trying to
car and how
figure out
easy
the
this
look.
is, right? We always had Hudson on the left and Emma on the right. And if Emma had a problem on her, right, we should have just moved them, just switched them.
Switch
Yeah.
positions.
Because
Yeah.
they're going to
just
keep
sitting in the
looking
car,
at
it's
each
in the
other.
car, yeah.
Exactly. They're
Oh.
always looking at one thing. Put the thing on the other side.
That is an amazing tip right there. There's a lot
Right.
of people who have more than one child. That helps.
Absolutely. And
Put them on the other side of the car.
I joke all the time. I said, I am never going to give a parent 20 minutes of exercises they have to do every day because I'm a realist.
Right.
If I give you 5 minutes of things to do, it's usually combined with something else. Like, if your baby likes bath time, I'm going to have you massage that muscle while they're in the bath.
Yeah.
So you're cleaning their neck. Their skin is soft and easy to get in there and do it. And you're done. Parents are busy. And
I like those other things.
I can't.
Just put them on one side so that all this stuff is over here, so
Yes.
they can start turning this way.
Absolutely.
And
It's-
leading
it's
into
a
that,
simple
obviously,
thing.
is another very common diagnosis of torticollis,
Yeah.
Hey-o.
which is another big
which
one
is
at that same
part of it.
frame
So
that you're
there,
working with.
There are 3 things that we see that go together, and the most common things. If one child comes in with one of them, I always screen for the other 2 because 99% of the time they have all 3, and that's torticollis, the flat head, so the fancy name plagiocephaly,
Ooh.
which means flat head.
Flat head.
That sounds very genius.
Yeah.
Very
Clinical
fancy.
genius extraordinaire.
And the last thing is reflux,
Okay.
where babies will spit up a lot. And the reason for that is, and I tell people, turn your head, look up a little bit. Now try taking a drink of water.
Oh, it hurts.
Are you going to swallow more air?
Yeah. You're gonna
It's going to be gulping. You're going to get a lot more air in. You're going to get a lot more gas. They're going to be fussy. They're going to be uncomfortable. And it's just because their head is turned that way and they're not able to get the swallow in.
Yeah.
So babies, they'll gulp when they're drinking a bottle. People will hear them.
Yeah.
And I said, just listen to your baby. If it doesn't sound, it shouldn't make noise while they're eating. You should just hear them swallowing like we do.
I'm trying
I
to.
wish I knew Kim when I
I
had
was
my
about to
twins.
say, I've known Kim for like 13 years already, and I'm like wowing on camera right now. I'm like, I've never heard this before. Like, we've been working together
My
forever.
twins are 14. They were
Yeah.
preemies. They had reflux.
Yeah.
They had colic. I'm like, there's so many things.
Yeah.
We'll go into the one thing I know with Gavin's ears that Chiro
yes,
helps him
absolutely.
gravely. That'll be later in life. But
absolutely. That's one of the things we get into as they get older into that,
that
toddler and
year.
preschool
Yep.
phase. Yep. So, and that again goes along with it because if they were children who had their head turned to one side, more liquid was going down on one side than the other, those babies tend to have trouble clearing the ears out. They wind up with more ear infections typically on that side because the muscles on that same side, it's stagnating. So whether it's just mucus in there or what they're drinking, so these babies who get the chronic ear infections, they wind up with tubes early on. It's all about mechanics. It can't clear out.
Can't train.
I said fluid stuff in the sinuses and the head, very much like water. Running clear in a river, good to drink. Stagnating, stay away from it. If it stagnates in there, it's going to build up bacteria, viruses, and you're going to wind up with a sick kid.
These tubes are like these thin walls. They're like balloons and this, that, the other thing. You can imagine if you pull a balloon, it's going to get narrow on the one side over there. There's nowhere for it to drain. So you have to kind of get that normal shape out to it. You talked about that with the uterus last time with the slings. One sling being a little bit too tight, it's going to pull and it's not going to create enough movement.
Our body
motion.
is all about balancing left and right. From head to toe, your body's always striving for balance.
Balance.
That's what I always say, like homeostasis. That's the word. Like homeostasis is like your body finding its own natural balance, and anything that offsets that from the time you're born, until the time you die, like it will offset your whole body in one way or another. So,
people with their posture, I say all the time, if your head is tilted like this, the rest of your body's going to have to shift in all the other ways. If your pelvis is tilted this way, the rest of your body, because your eyes are naturally meant to focus on the horizon.
Riding
You gotta
reflex.
Right yourself up.
That's
it's all
it.
about equilibrium, and when that's off, our balance is off, and everything's all messed up inside.
You could tell her that, especially when we do like the orthotic scans and stuff like that.
Oh, my goodness.
You tell people based off the way they're walking their gait, you know exactly which hip is high, which shoulder is high, which way to neck. And you can just take that in 2 seconds, and then of course our scanner shows
button
you
on the scanner, I told you so.
Yeah, we draw it. We draw it on the back of a piece of paper where it says, "I guarantee you, this is what it's going to look like." We look like geniuses.
He likes his word.
See,
Easy.
Keri, you are a clinical genius.
Oh my gosh.
So it's so true, though. It's like your body is always trying to get to a level.
It's always trying to get to that level. And these milestones that the kids are, supposed to meet by a certain level, and it's a very broad range. There's developmental things with each child is different, and we're looking for the outliers, kids who haven't really come close to any of that by a certain age, where we start to say, let's see if there's something that's hindering them or that could.
You're talking about outside the standard deviation,
right?
Because
exactly.
people are freaking out. If the standard deviation, the middle of the bell curve is here, and this is the standard deviation, people living in here, they're freaking out. They shouldn't be. It's the people who are here that we need to really start to address.
If suddenly you realize, oh, well, my baby's a year old and they can't sit up yet, we're ready to see you and we're kind of past it.
And I
If
think you have
you're
seen
one and
first-time
you're not
moms are
walking,
seeing this more and more. The panic button is hit
panic.
because they see other kids with the milestones that they're hitting in like the Mommy and Me classes. I had a baby today that I just absolutely love working with. And like the way we talk about tummy time and flattening and all of that, as that progresses, if they don't do the tummy time as when they're younger, obviously as they get towards that first year where they should be, you know, coming up onto all hands and knees and then pushing to crawl and stuff like that. If they're not on tummy time tolerating that, they're not going to integrate those next steps.
Right.
Absolutely.
And I know sometimes like the moms are the ones that kind of like once that baby fusses and prone like on their belly, they're like, oh, they don't like it, and they take them out of it. Like, let them not like it.
Let
They're
them
not,
fuss.
I'll tell you right now, if your baby can't roll over, there's no harm that is going to happen by walking out of the room for 2 minutes, go to the bathroom, curl your hair, let them lay on their belly in a protected environment. They can't roll side to side. Nothing's going to happen. The
You're
dog's not going to
teaching
jump
them,
on them, you know?
You're teaching them skills, albeit you're teaching a very, very young child skills, but you're going to be teaching these children skills for the rest of their lives. By the way, this is Brittany Heffitz. I don't know if you know her. She's a sleep consultant with children, never like that. So she's the one that kind of brought that to my attention. But you're teaching them a skill very early. You're going to, you know, and that's it. So you're just going to let them cry, and you're going to teach them a skill. And they're going to learn.
Can't get hurt.
Yes.
And you allow them, you know, oh, that's uncomfortable. Turn their head to that side they don't want to turn. That's uncomfortable. Guess what? They'll turn it and then make it more comfortable. Oh, now I want to look at something over here. I'm going to look at that.
Right.
I'm on my belly and I don't like it. Okay, I'm going to learn to roll myself over. That is how nature has taught us to do
Pain and
these
pleasure,
things.
right?
Yeah.
Pain and pleasure.
So if we move forward, like if you're going now into segments where you're teaching that child now as a chiropractor to progress from, you know, being on their belly to quadruped, hands and knees, and then starting to crawl, things like that. What are you doing typically with each of those children?
So most of them, I start from the very beginning. We look at those primitive reflexes. Those are the ones where, you know, you put the baby down and they flail their arms like a primitive monkey who is in the tree reaching for mommy. The baby who you put your finger in their hand and they grab it. Those are important in the beginning. We want to see as they're progressing how those are being integrated into everyday life. They shouldn't still have those as we're going on. So we're looking, as a chiropractor, I am looking to make sure that their reflexes are catching up with the rest of their body, that they're integrating the things they should, that they haven't retained any of those things. For example, a baby who is very colicky often tends to retain that startle reflex longer. Everyone's held the baby who you finally got them to sleep in your arms, and you go to finally you inch them down into the bed, and the minute you let go of them, they shake their arms and they're awake and they're screaming again. That baby tends to have a prolonged startle reflex, or it's ultra sensitive.
Yeah.
So in that
So-
moment, are you treating or are you referring that out possibly at that point back to their
So
pediatrician or
This
to
is where
pediatric
exactly
specialist?
where we co-treat.
Right.
I always refer out where there's any chance it might be something more than just irritation of the nervous system. I work with neurologists, I work with developmental pediatricians, I work with physical therapists like yourself, and we make sure that all the bases are covered. I love when babies come back with their parents and the parents said, I went to all the specialists and everybody said, everything's fine, just keep doing what you're doing.
Right.
That is my
There you
favorite
go.
answer,
That's great.
but I always make sure that I do it. I make sure that I'm not freaking the parents out. I said, I don't want you to freak out, but I want you to go have this checked. Make sure that that's all we're dealing with is something that just needs more practice.
Yeah.
Or on the side of caution.
Yep.
Yeah.
Yeah.
Well, I thought it was really cool when my pediatrician, Dr. Fish, who I loved, he moved to Florida, but he definitely had a bit of a holistic approach where Gavin kept getting recurring ear infections. And he's like, Keri, listen, I don't want to keep putting him on an antibiotic. You know, he would try like the drops, and if the drops don't work, then you go on antibiotic. As soon as I took Gavin off the antibiotic, the ear infection would return. And he was 2.5. So I ended up going to Dr. Fish. I'm like, I can't keep putting him on this. And he's like, Keri, the next antibiotic I could put him on, and he named the name of it, is one that like my elderly patients have taken. I was like, no. He goes, so I don't recommend that. I would send him to a chiropractor, and this was before I started working here and obviously knew Kim. because they do the softest adjustments and like movements in the neck just to open the passageways that aren't naturally fully developed until they're like 7 years old.
Right. Yep.
And I did do that and take him to a chiropractor, and my kids would ask, when are we going to the tickle doctor? Like they actually really liked him. And they would just lay right on me. I would lay in the chair.
That's correct.
And he would just come and do the slightest movements. Yeah. And that was the last ear infection that my son had that year. And literally the next fall, when he got his first one, I brought him right back. We did 2 sessions, and that was it.
Done.
Yeah. You know, and since then, knock on wood, I mean, he's 14 years old. You know, he's taller than me.
Right.
No problems growing, but has never had ear issues again.
Right.
You know, so it is incredible what you guys do. It really is.
It really is awesome, and it helps develop as they're growing. I can tell the ones who did have treatment and the ones who didn't. So, for example, if someone brings me a 3-year-old and I'm seeing that they have chronic upper respiratory tract infections and they're like, I just don't think he hears me that well, or he's not enunciating his words, I go right back to the basics and I check that upper part of the neck and I check to make sure they're draining and that those nerves are working. And we get that head up where they, again, maybe they didn't do tummy time as much. So they don't have that natural curve in their neck. Their posture isn't forming properly. They're not getting the drainage. And now it's developing into things they should be able to do by that age. They're having speech delays.
Yeah.
And this is how it turns out. If we don't address them in the beginning, then we have to go back to the beginning and kind of take a look, start over. Thankfully, it goes very quick. The best things about working with kids, and one of the reasons I love it more than anything, they make me look so good.
They respond so much quicker than adults.
So much faster.
I mean, it's so funny because we talk about the fact, like, you know, chiropractors, you crack backs. I'm like, why do you think we went to the back? I mean, the science is it houses the central nervous system.
Yeah.
We didn't just randomly one day say, I think we're going to just make a whole medical professional on cracking backs. I don't know why I went southern on that, but like that's not how it happened. We know that the central nervous system is housed by the spine and the brain is housed by the skull, and a little slight alignment issues causes interference in the transmission of those nerve impulses. And if the nervous system controls every single cell in your body, you can imagine those subtle alignments that cause interference with that nerve transmission is going to cause those areas to not function correctly.
Correct. Yeah.
It's as subtle and as simple as that. So by removing the interference, you're allowing the body to do what it does best, which is stay in homeostasis.
Yeah. And who wouldn't rather do that and try that versus surgery? Like if my son's option was tubes and a surgical procedure where I had to put him under to get tubes, of which, by the way, can fall right out. Like there's no guarantee. They can fall out and you have to get it done again.
They can
Why
still
would
get
that
infections
be
with
something
tubes
that
in.
Got a question.
I choose?
Can you reverse that surgery?
No.
Right? What's the worst case scenario if you tried to go the holistic route? You try to get treated by a chiropractor or a physical therapist. The worst case scenario is it just doesn't work.
Right. Yep. And then you do
then you can progress.
And that's what I love, a doctor that can see that and say,
Exhaust.
hey, we could do this, or you could try this first.
Try it first. Exhaust all your conservative options, the options that have no negative side effects to them.
Yeah,
absolutely.
You know, so.
Absolutely.
Well, I have to say, Dr. Kim, you and your profound experience with babies and children, we didn't even get to tap into your entire experience with the sensory programs that you run for kids.
Yeah.
We would definitely want to do another segment on that because
third episode
program is incredible. Like what you've really put together. Dr. Kim, for anybody that doesn't know, has also gone out to local with the preschools that you go out to and tried to create programs for people that have issues.
A lot of the parents groups where the kids are in elementary school now and maybe not necessarily qualifying for the in-school services.
Right.
And we talk about, we talk about how they can help their children do better in school, even though they may not qualify for the, state-funded this and that.
Yeah.
You don't have to classify your child to know that your child could use a little extra help in something.
Right. Yeah.
Oh.
And so it's something that, again, when we don't get it taken care of in the beginning, it shows up later on, and now we have to come back and reteach them how to do those things, and so then their body can thrive.
Yeah, absolutely. We've seen it firsthand. So
I think you knocked 2 home runs out of the park over here, and we're gonna get you back for round 3. It's gonna be important, I'm telling you. But great job again, Keri.
Thank you very much, guys.
You're
You
locked
haven't
in.
sold me yet.
You're locked in.
on the co-host.
You're completely locked in. She is the co-host. She still thinks she's not going to be the co-host. You are
I
out
do
of
love the logo that you came up with.
Aw, what do you think?
I
You're-
actually
like
do
it.
it just because I might sit. in
whatever
front of
I
this
have
logo.
to. You can here. We can move this way over here like that. Whatever it takes,
Your
Keri.
big head is blocking
My
it.
big head. That's because I got treated chiropractically very young age. I got a big head with all that brain in there. Again, ladies and gentlemen, you are listening to the highly trained, wildly unfiltered healthcare podcast. I am the host, Dr. Pete. My co-host and physical therapist extraordinaire and clinical genius. I'm going to say it a million times, Keri Moran. And our guest, once again, who might just be another co-host because she's going to be here a million times, Dr. Kim Delmage. Ladies and gentlemen, thank you so much for joining us. Do you have anything else to add before we get going?
No,
Dr.
we'll
Kim?
definitely keep our eyes and ears open for the next one so that we can do sensory integration.
I just want to thank you guys so much. I feel like this gives me an opportunity to empower people to know, like, don't freak out about all the things you see online, all the things. We want to be that place where we'll give you actual knowledge that has a basis. And
Absolutely.
we're not going to, can I say bullshit? I can say bullshit,
Yes,
right? We're
absolutely.
unfiltered.
I think we're
Unfiltered.
unfiltered.
Right. You don't have to listen to all the bullshit that you hear online about, like, oh my God, if you don't do this, tummy time
Yeah.
from day one, your baby's going to. No.
And something too that we do, call our office at any point in time and we will set up a consultation
Yes.
with Dr. Kim. So if you
Yeah.
don't know if you as a prenatal, postnatal woman or your child is a candidate for Dr. Kim's services, we do a free consultation, a phone consultation,
Oh, yeah.
or you could even do an in-person consultation. We set that up and
There's this
and
new
she will
thing
go
out there.
over-
Oh my God, these people have been using it. Zoom. Yeah, we could do Zoom too, guys. We got Zoom over here, so all
Yeah.
fully things. Thank you so much, Dr. Kim.
I like to help people not freak out.
Yeah.
It's
That's
important.
what we do. Let's not freak out.
Yeah.
And
No
I
freak.
love to, really quick, I'll cap with this. I love going on Facebook now and seeing somebody looking for somebody to help their child and seeing your name everywhere. In so many different comments,
I
you know,
am
and
blessed
if somebody
that
else
people
didn't
like
say
to-
it, somebody's like, oh, I've actually heard great things about her. So great
Yeah.
job. Great job.
Very blessed to have. I said, I only like nice people, and every day my schedule is filled with happy, nice people.
Happy babies.
Happy babies.
They're
No angry curmudgeons.
They're pretty darn cute, too.
Aw.
Thank you.
All right.
Thank you, Kim.
Thank you.
Thanks for having me.
Till next time.
Bye,
Bye,
guys.
everybody.